Hi everyone. So I'm going to take you through a presentation that I've created to take you along what I've done so far in my review. So the reason why we're doing this review is, as Cam has said, there is research, but a lot of the research is either based on adults or is done abroad on younger people. There's very little research that's actually been done in the UK on young people, and the research that has been done has looked into the following: so perceived discrimination, trauma transmission, indirect racial discrimination, and racial discrimination. So there have been links with perceived discrimination and psychosis for a lot of adults in and out of the UK. There has been research done into Brexit and how it's increased GAD, so generalized anxiety disorder symptoms, for adults based in the UK, but so far I've not found anything that's looked on how it's affected children in the UK. And there's been quite a lot of research that's looked into trauma transmission, so the idea that it's second-hand racism. So for very young children, they may not face direct racism, but it may be the racism or racial discrimination that their parents have faced that then leads to them feeling the symptoms as well. So as I've said, it appears that there's little research that's investigated how racial discrimination affects young people's mental health, specifically in the UK. So I had a look at 6 databases, and from all of them, I found 9,423 papers. After going through duplications, there was a remaining 7,925. So I specifically looked into, my search terms were based on mental health, children, racism, and the UK. So the inclusion criteria that we created was peer review publications containing original data, that it needed to be UK-based research, that it was specifically examining associations with experience of direct or indirect racism, that it needed to have mental health outcomes, and that participants aged up until the age of 18 were okay, as long as the mean age was 17 or less. We specifically chose this age group just because it is a rapid scope review. So there wouldn't be enough time to go through all of them. And if it was anything above the age of 18, for example, maybe up to 24. So I would need to go through quite a few papers full text, because in abstracts, they don't seem to really state the exact age group they're doing. So what we found so far, I've gone through 1,000 papers so far, and of those 1,965 were excluded, just off the basis of title and abstract for not meeting the inclusion criteria. 35 were put into maybe on the basis of their title and abstract. All 35 went into full text screening, and of those 35, only one study has been confirmed to be included. The other 34 did not meet the criteria on the basis of predominantly age of participants, the study not being based in the UK, or not having original data. So I'm going to share with you the one study that I did find. So this study looked into adolescents' views on preventing self-harm. They had 2,915 free pupils aged 15 to 16 across UK secondary schools. They were doing a qualitative research, and they were asking what could be done to help prevent young people from feeling like they want to self-harm. And in the responses, bullying came up, and from bullying, discrimination, racism, or general aggravation was an aspect of bullying that they felt could lead to young people harming themselves. However, it is really important to note that with this paper, it was an incidental finding. So this wasn't a paper that directly looked into racism. It just so happened that in the conversation, racial discrimination has come up as part of bullying. And so from what I've looked into so far, it's quite clear that UK youth need to be focused on and exploring how racism has affected their mental health. It's also very important to note that not everyone who identifies as BAME experiences racism the same way. This was something that was highlighted in the Bramford et al. Study. They found that some participants who were in the BAME community suffered from racism more than others, and so they felt like it was important to state that not everyone suffers the same way, and so one race may suffer more than the other. And it's quite important to look into direct and indirect experiences of racism. So the studies that I've seen, quite a lot of them are looking into direct racism, even with young people, but it's quite important to look into indirect and to look into secondhand exposure of racism, especially if we're looking into young children who may not necessarily be in school, or who are in school but at quite a young age, and so may not experience direct racism. And that's it.